Today we are presenting actually a new method to control hypertension. We all know that blood pressure is a very common problem in the general population, and it usually causes a lot of complications. Patients can develop heart failure, they can have heart attacks, they can develop kidney failure. All these are related to uncontrolled hypertension. Now, most of us think that with adequate treatment and going to a doctor regularly, we can control our blood pressures. But even in advanced countries like United States of America, it has been found that with the best possible therapy, still only about 30% of the population who have blood pressure come under control. So that is a huge public health problem. So there are a lot of hypertensives going around who don't have their BP under control. For this, there has been a new technology which has developed over the past 2 years, where what is done is that there are vessels called as renal arteries. They are the vessels which supply to the kidney. Around the vessel, there are certain nerves which produce some substances. These are called as sympathetic nerves and sympathetic hormones which go into the blood and cause a rise in the blood pressure. Now, indirectly, by causing some kind of damage to that particular nerves, we can prevent that sympathetic stimulation from occurring. This is called as sympathetic denervation. This, for the first time, we are bringing here to our country, and we have already done about 4 cases, and we are finding very good results. Probably all over the world, the experience is hardly around 200 to 250 cases, and now India will be at the forefront of technology as far as hypertension control is concerned. Now, who are the patients whom we are looking at? Mostly, as of now, we are looking at patients who are not coming under control by giving adequate number of drugs. That is usually defined as about 3 drugs. So, patient is on 3 antihypertensives and still it's not coming under control. They are the patients who will benefit from this type of a therapy. This is a totally safe procedure, very safe. It's just like an angiogram where we put a catheter inside, and then wherever the nerves are there, we just give small burns and then assess the blood pressure response over the period of next 4 weeks. From our initial experience, we have found that we can significantly reduce the drugs, and some of the patients we have been able to even go off the drug. So this is a very good modality, a new therapy which has been there, and it's going to help many of the patients in whom hitherto we had a lot of difficulty in controlling blood pressure. Yeah, this is the first time in India that this therapy has been done. We did it as a part of the workshop about a month back, and since then we have already done about 4 cases. So this is the first time in the country that this is being done, and even as on today, this is the only center where this therapy is being offered. Nowhere else it's being done. See, there are 2 ways of looking at it. One is we are still not looking at a cure of hypertension. That means we don't expect that patient will not take any drugs after we have done this therapy. But at the same time, there are patients who are taking 6 drugs, 8 drugs, and still BP is very high. Their kidney failure keeps progressing. They keep getting admitted because of heart failure. They develop heart attack, brain stroke and all that. Now, once you provide this therapy, at least the control will be better. So you might be using just 1 or 2 drugs, or you might be using just about 2 or 3 drugs to control the blood pressure. That way, BP in itself doesn't do anything. But because of BP, the other organs get damaged. Our basic idea behind controlling blood pressure is to prevent damage to those organs. So when you do this, you prevent that damage.